Hello, I'm Richard. I'm an obstetrician at the Norfolk and Norwich University Hospital, and I'm here to tell you about your pain relief options in labour. It's completely normal to feel anxious about the pain that comes with labour. Thankfully, there are some options available that can make it easier for you. I'll go through each of them in this video. For some mums, relaxation techniques are enough to get them through. For instance, breathing exercises, meditation, massage, and keeping mobile. Other mums need a bit more help and hire a TENS machine to help them in the early stages. This is a small machine that attaches to your back and stimulates your nerves with safe amounts of electric pulses. These machines are brilliant for back pain during early labour, although it will be harder for your birthing partner to massage you. One of the most popular methods of pain relief is gas and air. With gas and air, you'll be given a mouthpiece and instructed to take deep breaths of gas and what's known as Entonox, which is 50% oxygen and 50% nitrous oxide. The oxygen you take in is good for your baby, but gas and air has some side effects. It can make you feel a bit sick and lightheaded, but it doesn't linger in your system for long, so these effects are temporary. It's also just a mild form of pain relief, so may not be enough in established labour. If you need something stronger, PETHidine may be best for you. This is injected into your bottom or thigh, and it can relax you so that your contractions are more effective. It'll numb the pain, although you might not like the detached feeling that comes with it. If it's given too close to the birth, there's also a possibility that your baby will need an antidote to aid breathing, although this is rare. Some hospitals use other drugs similar to PETHidine, so speak to your midwives about which ones they use. Finally, there's an epidural, a method which normally numbs the pain altogether. Essentially, you won't feel the contractions at all. With an epidural, anaesthetic is injected into the lower back, numbing your body from the tummy down. It takes about 20 minutes to set up an epidural, but the effect is immediate. Just be aware of the side effects of this one. It can be patchy if the anaesthetic doesn't reach all the parts it's supposed to, and it can cause your blood pressure to fall, so you will need a drip. It has been linked in some cases to short-term backache, and it can actually make the second stage of labour last longer. You may also suffer with a headache after your little one's been born, but this is rare. What you won't have with this one though is a drowsy or lightheaded feeling. But it's important to think about the added complications with an epidural. You're more likely to need an assisted delivery like a ventouse, forceps or caesarean. It's down to you what method of pain relief you choose, but be sure to think carefully about the pros and cons of each before you decide.